I have the great pleasure now of being joined by Dr. David Marrero, who is the ADA President, Healthcare and Education. Thank you so much for being here.
Thank you, a pleasure.
I know you're on the board of directors, really reaching out and talking to people about science, healthcare, trying to educate people. What do you think is the biggest challenge right now?
I would say there's two challenges that are really quite important right now. The first is that we really need to continue our research initiatives and efforts to look for the cure for diabetes and better levels of clinical care and support for people with diabetes. The second area that I think is very important for the American Diabetes Association is to pay greater attention to the mental health and behavioral aspects of diabetes. This is certainly a disease where mental health is a serious issue. People with diabetes are twice as likely to suffer from depression, for example, than people without diabetes. Yet we don't really have yet the scholarly attention and the clinical attention to this very serious problem.
I know you also have a large focus on technology and the better use of technology to try to educate people and to get them to comply. Can you talk about that a little bit?
Oh yeah, I think technology is one of the great innovations of our time. We have the ability to do continuous glucose monitoring, which lets us look at glucose in real time, whether we're going high or low, and to intercept it. It's remarkable technology, and I think more people should use it. We have a lot of social connectivity capacity now, where you can talk to others that share your condition and hear what they're doing to struggle with different types of situations that arise when you have diabetes.
I know you really are the liaison between the physicians and the researchers presenting the science here and the public, and also the lawmakers who maybe control some of those dollars for research. So at this point, what is your message to them?
My message is that diabetes is probably the most significant public health crisis of our time. It exceeds almost any other disease I can think of in terms of both social cost and fiscal cost, and that we need to really start thinking a little bit more about how we're going to approach this epidemic. If left unchecked, 1 person in 3 will have diabetes in the next 20 years. That's very significant numbers. We're talking millions and millions of people, and it's preventable to a large extent and highly treatable to a great deal of reality now. And we need to focus on that. We need to make policies to support that. We need to support research more aggressively, and we need to be more aggressive about quality care and making sure that people have access to all the aspects of quality care.
So what would be your key message to the ADA membership right now, going from being at this meeting and being so inspired back to clinical practice, interacting with patients, or perhaps going back to their research?
I think that the ADA is driven by passion. And the people that are involved with the ADA at the organizational level are all passionate and concerned about the issue of diabetes and really struggle and work mightily to address it. And I would say for everybody here to get inspired, to become involved, to become a volunteer, to become an advocate for people with diabetes.
Because in that vein, you'll be helping each other, but also helping the patients as well.
Exactly.
Dr. Marrero, thank you so very much.
My pleasure.